Hello everyone, I am Dr. Nkendong, a psychiatric nurse practitioner. Today I'll be diving deep into a paramount topic that binds the realms of psychology and psychiatry. We are set to explore Maslow's hierarchy of physiological needs and how they are profoundly interrelated with specific mental health conditions, namely depression, anxiety, and bipolar disorders. I'll assess these disorders through the prism of the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. Before I go any further, I would like to say this information is intended for educational purposes only and is not a substitute for professional medical advice. Always consult your healthcare provider before making any medication or lifestyle changes. Before delving into these conditions, let's establish what we mean by Maslow's physiological needs. At the base of Maslow's hierarchy lie essential requirements such as food, water, warmth, rest, and shelter. These needs form the bedrock upon which higher psychological needs, like love and self-actualization, are built. Ignoring these foundational needs can lead to a cascade of problems affecting both the body and mind. Why are these physiological needs so critical? Simply put, they are vital for our overall well-being. They serve as a balance for not just physical health but mental stability as well. The DSM-5 identifies several disorders where physiological needs are closely entwined with mental health. In Maslow's framework, basic physiological needs such as food, sleep, and bodily health sit at the bottom of the pyramid. These basic needs are followed by safety needs, which include emotional and physical security. Individuals suffering from depression often experience changes in appetite and sleep, affecting their ability to meet physiological needs. Similarly, anxiety can cause physical symptoms such as a rapid heart rate or gastrointestinal issues, again impinging on physiological well-being. As we move up Maslow's pyramid, we find the need for love and belonging, characterized by friendships, family, and sexual intimacy. The social withdrawal that frequently accompanies depression or the avoidance behaviors linked to anxiety disorders could potentially compromise an individual's ability to meet these needs for social interaction and connection. Higher still on Maslow's pyramid, we encounter the need for esteem, both from oneself and from others, which involves achieving, gaining recognition, and feeling valued. For instance, the symptoms of bipolar disorder, particularly during manic or hypomanic phases, may lead an individual to make poor judgments that could jeopardize their career or social standing, thereby affecting their self-esteem and potentially resulting in societal disapproval. Finally, at the pinnacle of the pyramid is self-actualization, where an individual can realize their full potential, creativity, and capabilities. The presence of conditions like depression, anxiety, and bipolar disorder can serve as considerable roadblocks to this ultimate stage of psychological development. Mental health disorders can limit an individual's ability to focus, to form and maintain relationships, to work productively, and to engage with the world in a meaningful way, thereby preventing the attainment of self-actualization. Thus, it is evident that the symptoms of these mental disorders as described by the DSM-5 can have a multifaceted impact on an individual's ability to meet the needs described by Maslow's hierarchy from basic physiological needs to the more complex psychological ones, culminating in the quest for self-actualization. Therefore, the management of these mental health conditions is not merely a clinical concern but also a fundamental necessity for enabling individuals to journey through Maslow's hierarchy toward achieving a more fulfilled and actualized life. This interpretation is supported by a wealth of evidence-based clinical data, including studies that explore the relationship between mental health and quality of life, as well as those examining the role of social, occupational, and psychological functioning in the manifestation and management of mental health disorders. Eating disorders such as anorexia nervosa and bulimia nervosa directly impact nutritional intake, leading to various physiological imbalances, including electrolyte imbalance and gastrointestinal problems. Substance use disorders and sleep-wake disorders like insomnia are also bound up with poor physiological regulation, exacerbating mental health conditions and creating a vicious cycle of deterioration. Addressing the foundational layer of Maslow's hierarchy of needs involves ensuring basic physiological requirements like food, water, shelter, and sleep. When it comes to mental health conditions like depression, anxiety, and bipolar disorder, focusing solely on psychological treatments such as cognitive behavioral therapy and medications might not be sufficient. It's crucial to incorporate strategies that directly meet these physiological needs. For instance, individuals experiencing insomnia as a symptom or a contributing factor to their mental health conditions could benefit immensely from sleep interventions based on Maslow's physiological needs. Utilizing sleep hygiene techniques, which involve creating an environment conducive for sleep and maintaining a sleep schedule, attends to a basic physiological need that can, in turn, bolster mental well-being. The essence of holistic and integrated medicine is particularly relevant when seen through the lens of Maslow's hierarchy of needs. This comprehensive approach aims not just to treat mental symptoms, but to also meet physiological needs that are foundational to mental well-being. For example, dietary changes incorporate balanced nutrition, attend to a primary physiological need, and can also significantly impact serotonin levels, which are intrinsically tied to conditions like depression and anxiety. This comprehensive approach has support in evidence-based clinical data indicating that meeting physiological needs can significantly improve mental health outcomes. In line with Maslow's physiological needs, natural remedies can indeed offer valuable support. Ensuring proper hydration can mitigate symptoms of fatigue and cognitive difficulties often associated with depression and anxiety. Herbal supplements like valerian root, commonly used for insomnia, can serve to meet the physiological need for sleep, thereby providing a foundation for improved mental health. However, these natural remedies are not a substitute but rather an accompaniment to medical interventions like SSRIs for depression and benzodiazepines for anxiety, which are aligned with DSM-5 guidelines. This integrated approach, encompassing both natural remedies and medical interventions, aims to fulfill both physiological and psychological needs in a balanced manner. A holistic and integrated medical approach is one that looks at the person as a whole rather than focusing solely on treating symptoms. It integrates traditional Western medical practices with alternative therapies like acupuncture, herbal medicine, and mindfulness techniques. The idea here is to treat not just the mind but also the body. For example, alongside psychotherapy and medication, a physician might also recommend a balanced diet and exercise regimen to improve physical health, which in turn can positively impact mental well-being. Such an approach aligns well with evidence-based clinical data that suggests treating the physiological aspects can significantly contribute to mental health outcomes. Natural remedies can be an essential part of this holistic strategy. Proper hydration, for instance, can significantly impact mood and cognitive function. A balanced diet rich in essential nutrients can positively impact neurotransmitter function, thereby improving mental health conditions. Mindfulness techniques, often incorporated through practices like meditation, can also provide significant benefits. These natural interventions, however, are generally most effective when used in conjunction with medical treatments. SSRIs, or selective serotonin reuptake inhibitors, are often prescribed for depression, while benzodiazepines may be used for acute anxiety episodes. These medical treatments are usually tailored to individual needs and are often adjusted based on DSM-5 protocols. In conclusion, the relationship between physiological needs, as laid out by Maslow, and mental health conditions like depression, anxiety, and bipolar disorder is both intricate and foundational. When physiological needs are not met, the likelihood of developing or exacerbating mental health conditions increases, thereby creating a cyclical problem that demands comprehensive treatment. As healthcare providers and concerned individuals, we are morally and professionally obligated to adopt an approach grounded in holistic care and evidence-based practice. This isn't just about symptom management, it's about embracing a more expansive understanding of well-being that harmonizes both mental and physiological needs. Before I bid farewell, a quick word from our sponsor. This video is sponsored by The Forgotten Healthcare, a 6-part documentary that shed light on mental health stigma and provides solutions to counter this problem. Click on the description link below to access The Forgotten Healthcare. Thank you.